Hamed, thank you for taking the time to do this. It's so great to be here with you in Toronto.
Thank you. It's great to
Great.
be with you.
Oh, yeah. Always a pleasure. It's American Thanksgiving.
Yeah.
Happy American Thanksgiving.
Thank you.
Got the
Happy
fire on
American
for
Thank.
you.
I don't know what it is about American Thanksgiving. Like it does warm your soul, doesn't
Yeah, it
it?
does.
Yeah.
I agree. It does. It does.
Kind of like this virtual fire.
Exactly. Yeah, exactly. Um, we're here today talking about something really important, important, exciting, um, concerning in some
Mhm. Yeah.
ways. One can't wake up today in this world, opening our phone, putting on the TV without seeing something about AI.
Right.
Whether it's this kind of
Mhm.
epic saga for the control of OpenAI, whether it's NVIDIA continuing to hit all-time highs as such a critical chip maker
Mhm.
in the industry, whether it's governments debating how they're going to handle AI at large and catch up with what is it, where does it go. Um, I guess I want to start with just high level, not healthcare related,
Mhm.
but what's your take on AI? Is
Yeah.
it is it is
Yeah, no,
yeah
it's a great question, and particularly this past week where, we've endured the OpenAI saga, right?
yeah
And and that leadership saga seems to suggest that even at the highest levels of, possibly the most important company at the center of generative AI, there's concerns about how the company's being run. I mean, there's always been concerns since generative AI took off that this technology could be misused, but it seems like those concerns were boiling over at the
yeah
board level and the management, and they weren't on the same page. And so, other than sort of the whole boardroom drama bit, which, gets everyone interested, I think this one really evokes feelings concern and a little bit of doubt. And I hope if nothing else, what this has done is it's now fermented, a common cause at the new board that's being formed, where they recognize the importance of creating a really strong, uh, you know, you know, uh,
governance structure.
governance
Yeah.
structure, risk management structure. So look, I'm an AI optimist
Mm.
at heart, right? So yes, there's no doubt that AI can be misused, like any technology, right? And I do believe that, and you've had folks like Sam Altman, to his credit, talk about the need for regulation. He's like, please come in and regulate us. And so I do think that the regulators really have to do this work. But look, I think there are good news and bad news stories. We're at Well Health, which is a company that I founded and I run. We've already used AI, in helping our physicians be more
Yeah.
productive. And
I've heard personal stories about the
yeah,
success it's
absolutely.
had with physicians.
Absolutely.
Yeah.
We have an AI scribe that physicians use that with, patient and provider consent can listen to the conversation and is smart enough to kind of remove, conversations about the cottage or the kids or the vacations and then essentially create a medically relevant, succinct note that the physician can alter if they want and pop it into the electronic medical record that gives physicians back hours in their day,
Yeah.
which is tremendous. And we've had people practice for decades say, I can't live without this now, and
Yeah,
so
and that's coming from an industry um, that doesn't want to change quickly. A doctor, they're probably not the first on the list to embrace new technology, correct?
100%. Yeah, no, the change management challenge with doctors can be
Real.
really, really, really
Yeah, my
substantial.
friend described this as kind of that autopilot moment,
Yeah.
with airplanes.
I love that analogy, right? I mean, none of us would get into a plane without a pilot, yet the pilot doesn't really run the plane. The pilot is there to triage the notifications that are coming and override the controls if necessary. And lives are there in the balance of these machines and we know of stories where the pilot has had to overcome the controls. So,
but it's almost like it's an industry that you can't imagine it without it.
right.
And as you talk about time saving for doctors, I think probably that leads to better work enjoyment for the doctors. I think, it's in Canada for every 7 minutes, it's $30 or $35.
That's right.
And my good friend who's a GP here in Canada, he's just expressed to me that the time at the end of the day is actually where naturally someone's exhausted from their day, seeing 30, 40 patients, and he's making up so much time. And it's the stuff that he actually kind of didn't want to do.
Yeah.
Which was the follow-up. What were my notes? Was I really listening? Trying to do two things at once?
Yeah, so your doctor friend's talking about charting a lot of the times, which is, I saw this patient. I think I remember what happened, and I'll have to, create, the documentation in the patient record to really represent that properly. Because what happens if I'm not able to oversee this patient, next time they have an issue?
Yeah,
their record has to be complete, and that time is difficult, right? I mean. So what we found is that some physicians are very quick with those notes, and some take a lot of time with them. So it can literally give them back. We've seen some physicians get half of their day back, which
incredible.
Because sometimes some physicians spend more time on the note than they do on the consult. So
it's incredible.
So yeah, I mean that's just a great example of generative AI generating a note based on listening to a big conversation that can happen in different languages. I mean, that when we showed our physicians that, they thought it, when we told them about it, they said, their statement was, "Oh, what year do you think that would be available in?" And so the speed at which some of these seemingly magical things are being delivered now, I think again is delightful and scary in some ways for some people. But
so I want to get so as an AI optimist, these are the positives. Where do you see in your mind, where do you see concerns other than robots running around and take that kind of maybe aside the Terminator scene,
right?
Where do you see concerns?
I think overall, we're also in the cybersecurity business patient data safety and security and privacy is so important to us that we've actually acquired 4 cybersecurity companies to keep patient data safe, and we've also productized that for the industry at large. So we're starting to see AI-enabled threats. So smarter threats, smarter
attacks, smarter
exactly. And so so the bad guys are using AI to try to ingress and penetrate systems. It's stuff like that. Anyone who was trying to do anything before is now going to try to leverage AI,
of course.
Right? And so and then I think also people just that are fast and loose with this stuff on they have good intentions, but don't recognize the power of having this data misused by machines, right? And so I think at Well, for example, we'll never reveal someone's patient data without their explicit knowledge.
Yep.
And so I think it's just that, and I think we need regulation to clearly define some of this stuff. There is a little bit of gray area out there. I think the working controls that we have are pretty good, but yeah, I just worry. The thing about healthcare that's different is when you have a breach of a credit card number. We hear this all the time. There's been a breach, so and so numbers of email addresses or credit card information. Get out in the wild, and that's not great, right? It hurts people. But you can change your credit card number. You cannot change your health information.
Yeah.
If you have a certain condition, if you have a certain rare disease, whatever the case may be, that's with you. And so people use that information to fish, to improve the ability to fish your information because like, wow, this, you get an email about your condition.
Yeah.
And you're like, well, this must be, authentic. So I'm going to click on this link and boom, your credentials are gone. So
people, it's a vulnerable
It's
a vulnerable access point.
Exactly.
Right?
And that info can't be changed, right?
Yeah.
So now you can just hope that, that information doesn't get out further, right?
Yeah.
So these are the things that worry me, but look, I think.
But net, you.
Yeah. Absolutely. Like, look, I think we also have a fairly significant crisis in healthcare, which is characterized by a shortage of physicians. Some of the things that you mentioned earlier, physicians are under extreme fatigue. They have to work really long hours. This is doctors are pillars of society, but they work hard. They show up every day. They don't get, it's not a return on equity business model. It's a return on time.
Yeah.
Most of them don't get salaries. It's fee for service, right? So they're there leaning in every day, and it's a real thing, especially, and they're here in Canada and most places in the world, their revenues are capped on a per visit basis. And certainly lately, they're not trending up in line with CPI, right? So we've had a healthcare crisis here in the last couple of years. You probably read about it in the paper. There's been umpteen articles. And
not to mention they spend a decade of their life getting educated for their profession. Yeah. It's a significant investment.
So physicians need support. And this is our mission as a company, is how do we tech enable and support healthcare providers? And I think AI is now bringing, to bear tools that are transformational in a positive way. So I think that's a great story. We're seeing it. And you and I have been working on something that's really exciting with HealWell, where we're now taking that to actual decision support, which is amazing. Because back to this example that you gave, where a doctor's spending 7 minutes with you, getting paid $35, and they're expected to know everything in this patient file of this person that they've may or may not have ever met. That patient file could be 50 pages, it could be hundreds, it could be thousands of pages for a complex care patient with all kinds of things going on. And they're expected to know that, and they can't possibly know that, right? And so we think it's unquestionable that the future of healthcare is algos, smart algos, AI, searching and triaging and really looking for patterns in this patient data and popping up notifications and then the physician's there to triage that and sanity check that and integrate information and be the Sherpa, the health Sherpa for the patient. And
it makes perfect sense.
Yeah,
it really does. And I think it's nice to see that it's not, as you say, it's not years, it's down the line. It's today. It's happening today. And the data has latent value, and humans won't go through all that data. There's a lot of latent value in that.
You're 100% right. This is what we heard all the time, right? But companies saying, we're sitting on this mountain of data. And in healthcare, everyone talked about that, but they weren't really doing much with it. And that was
this is the unlocking moment.
Absolutely. Yeah. And I remember people always coming to me and saying, like, we've got all this data, and I've been hearing it for decades, frankly, and I think this is a really interesting moment. I was at a talk recently, Mark Andreessen was speaking, and he was talking about solving this problem that, OpenAI, sort of, broke, I guess, in a positive way and brought to market. And he said, look, there are researchers that dedicated their entire lives to this. And, studied, contributed decades of their lives, died, and they never saw this moment. So we live in a really interesting time, and we should consider ourselves fortunate, and hopefully we do the right. I think we will. I think you're already seeing that generative AI is improving productivity. I think it's got the right people concerned. Even the whole OpenAI saga, I think in some ways is positive, because it just demonstrates that there is a conscience there. There are people concerned about this, and I think we'll do the right thing.
Well, your background, for those that don't know, Hamed Shahbazi, you like Elon Musk, sold your first company to PayPal for hundreds of millions of dollars. The 20-year overnight success. And then 5 years ago, maybe 6 now.
5.5-ish.
Yeah.
Yeah.
I was fortunate enough to participate in your first round on well health. And I've observed you build one of Canada's most important, if not the most important, healthcare platform. I've watched you acquire, I think, about 60 companies. The business is on its way to be $1 billion a year revenue business with great EBITDA margins. And now all of a sudden, I've been privy to our conversations, obviously, because we've wanted to work on something together for quite some time now. But why this heal well concept now? What is heal well to you? What is heal well to the Well family? And why is it so important to Canada today? And where do you see some of the vision potentially into the future?
Yeah. No, thank you. I've been fortunate to work with a lot of great people and actually a bunch of people from my first startup, TO, that was sold to PayPal, actually joined me at Well. So we were able to hit the ground running. And I started the company because I couldn't believe I had an experience in a physician's office, and it was remarkably bad and under digitized. And I was like, my God, like this is 2016 or 2017. I think it, yeah, it was 2016 then. And then it started to get me thinking. And then I started the business in 2017. I was like, this is really remarkable. We are, so behind other sectors in terms of digital lag. And so I couldn't believe, we've all lived in a time here in the last couple of decades where software's been eating the world, right? To quote Mr. Andreessen again. And it hasn't been eating healthcare, that's for sure, because I'm sitting here, I had to make my appointment with a phone call. I got a paper form. I have to wait 2 hours because everything's a mess and there's no digitization. And it just really got me thinking that
the office is filled with filing cabinets. You don't even know if you have space to go into your
it's crazy,
into
right?
the room anymore.
So I in speaking with doctors, I could see that they were frustrated. And then I'm a tech generalist. I wasn't a healthcare specific person. So a bit of an outsider. And I think I was told it's a good thing you were an outsider, because if you were an industry insider, you would have been so disenfranchised with how quick things move that you would have never started this company because of all the change management challenges. So I really wanted to see if as a tech generalist that's loved this idea of digitizing and modernizing, old school businesses, because I think every business needs to be tech enabled and every sector does. So that started the journey. And there's this conscious awareness when you get involved in healthcare that it is the provider, like it's all about the provider. That healthcare provider is a backbone of our healthcare ecosystem. They're the ones that we go to when we're sick and vulnerable, and who's supporting them? We have to tech enable them. We have to amplify them because there's not as many of them. Population growth is outweighing and out driving the growth of new doctors, right? And so we have to find ways of amplifying them. So that became the theme of the business. And you ask a really good question. Why now? So Heal Well is this investment and that we've made, and we've partnered with yourself, and we've launched arguably, I think, what could be one of Canada's most important AI companies, because it has access to Well Health's provider network. So we're the largest owner-operator of outpatient medical clinics, the largest doctor group in the country. And 1 out of every 3 physicians in Canada use our digital platform. And so we have enormous connectivity, with the physician community. And, we, as we think about what's really next in healthcare, it is this decision support. It is how do we help physicians overcome this feeling of overburden and fatigue, and like I can't possibly know all this stuff. And so Heal Well, we've launched this pure play AI company that's entirely focused on decision support and AI driven preventative care effectively. So why is decision support important? It is all about preventative care. It's about if we can detect and identify those cases, whether it's chronic disease, whether it's acute, whether it's rare disease or ultra rare diseases, if time is everything in healthcare, if you can bring these things forward by days, weeks, months, years, you save the healthcare ecosystem tons of time, cost, and trauma. You save a lot of suffering, right? So that's what this is, and it's really exciting. And we had a partnership with a company. We have an app marketplace at Well. It's called apps.health, and we have different startups, just like the Apple marketplace, but here you add applications that again get integrated into the clinic's practice management system that extend the capability of that practice management system. And we've had an app there that does some clinical decision support for rare disease. So a doctor who wants to participate would enroll, and they would then agree to have their data, their patient data scanned to identify these rare diseases. And pharma sponsors this, but they never get the information. It's anonymized search, a scanning, and then it pops up candidates for the physician to triage. And we've seen it save lives. So it got us very, very curious about, what happens if we could really extend this. So we've really packaged AI, this AI story around Cure Health, and now expanded, starting to really expand it, because they cover a slice of rare diseases, and we're going to identify the full spectrum of diseases and ailments, and that's an enormous task. We didn't think that we could do that under Well. It's another company. It would be a loss of focus for us if we tried to redirect all of Well's focus in this area. But it's unquestionably important to us because that's where all of healthcare is going. The business of being a doctor will involve AI. It has to for some of the structural issues that I just mentioned before.
I think. And again, another kind of an analogy to think about, because that always helps me frame, situations. But it feels like the way that Well has really been a first mover in this in Canada is the way that the telecommunication industry moved into wireless. Can you walk me through?
That's a great analogy. It's really smart, because you're right. The wireline companies, when wireless came out, they knew it was the future, but it was going to take losses. It was going to take losses, a lack of focus. The same exact thing that I just mentioned about.
They knew it was going to be the future, higher margin business, but they didn't want to kind of bet the farm,
right, until
the revenue model became more
right. Traction was there. Profits were starting to be made because they had commitments to shareholders. It's not very tenable when you're a public company with lots of stakeholders to come out and say, guys, we're gonna take a deep dive here for the next 3 to 5 years, and don't worry, even though profits will go down. I mean, that's very difficult to do. So I'm glad you brought that up, because this is a structure. We are out in the open with HealWell about a path to control. So Well, on a fully diluted basis, if we convert all the debentures and the warrants and options, have about 40% economic ownership of the company, and part of our option involves acquiring multi vote shares, and that could take us up to 90% or so in votes. And so IFRS, which governs the Canadian capital markets, indicates that if you have over 20% of economic ownership in a company and over 50% of voting share, you can essentially control that company. You can consider that as a subsidiary. And so that's very much, in the next 2 years, we have the ability to exercise our option and be essentially controllers of the business. But we don't want to do that until
it's more mature. Industry is more mature, business more mature. It makes perfect sense, I think, specifically in such a sensitive situation like healthcare data, and it makes. I think the structure. I think what you put together makes a lot of sense in this structure. And I think your thoughtfulness has has attracted this. Another thing that I've loved watching your journey is you've attracted some of the best investors in the world, the likes of Mr. Li Ka-shing, one of the world's greatest investors. And I think as the let's say the investment board that he's looking at, it's like as he looks at Canada, it's like makes his bet. I don't know, but makes his bet on you and in healthcare, and now the evolution of that digitization of the business is now okay. I know where the puck is going, to be overly Canadian, and let's be there. And I think that, albeit early days, you're rewarding well shareholders and respecting the well shareholders, while at the same time going where the puck is seems to be going. And at the end of the day, what I've admired about you is, you referenced even earlier on, it's like a societal pillar is healthcare. And what worked in the past doesn't always mean it's going to work in the future. And healthcare, broadly speaking, as sickness, just has increased, whether it's the pollution or food or people working too hard and stress, a number of things. You've been so focused on, just trying to make your influence. Yes, building big businesses, but it's how do we make such an important societal pillar better? And I think that those are the types of entrepreneurs that capital markets need to continue to get behind. And you're a rare breed in that sense.
Thank you.
Yeah, because you're making, yes, you're ahead of the curve, but you're building successful cash flowing businesses. So it's not like this incredible, idea that could make a lot of sense and is quite evangelical in its,
Right.
but so I think that's really rare.
No, thank you. I mean, look, whether it was TO in the past, which was all about
bringing banking to the
exactly,
underbanked,
bringing banking to the low to moderate income and the underbanked, and helping them reduce those fees that they were charged, which in many respects were highly egregious. So we saved consumers, the most economically challenged consumers, hundreds and hundreds of millions of dollars over time, which was a real delight. I believe having purpose isn't just nice to talk about. I think it results in better economic value.
Yeah.
Because I think a lot of entrepreneurs come into their businesses and they chase value creation at
the expense of,
I should say they chase wealth creation, and I think if they focus on societal impact, which is real value creation. What I found is that wealth creation always kind of happens as a byproduct of that. Yeah. Show someone you did something valuable, and you bent the curve in some way that's important, and you will get compensated for it. You know what I mean? And so back to your point, we've been really fortunate to have folks like Li Ka-shing and Selena Chow support us, and folks like that, they have a vision, and they know that. And this is where the alignment comes in. Healthcare, most of what we do today is sick care, right? It's actually sick care. You get sick, you go to the doctor.
Yeah, it's reactionary.
It's fully reactive, and that's not good, because once you're sick, it can be challenging to get you back, particularly in some of these chronic conditions in cancer. A lot of cancers are preventable if you treat your body, properly over time. If you exercise, if you try not to create an acidic environment for your cells just freak out.
Of course,
you know what I mean? And so so preventative health is healthcare. And so I always think about this, like doctors, you know, you don't want them to be, this analogy of a swim coach, versus, what's the person that sits on the beach and rescue lifeguard?
Oh, lifeguard.
Yeah, yeah. So, yeah, sometimes you're in the water and you're drowning and you need a lifeguard.
Emergency, yeah.
But what you
actually
really
need a swim
want is
coach.
a swim coach, right? You really, and that's what if doctors can spend more time talking to you about how to keep healthy, what to do, and doctors do that, particularly family practice doctors who have attached patients that see them over a longer period of time. That's they're providing that longitudinal care. That's the best care. But there's 5 million Canadians that don't have a family doctor. And so how are we going to do this? I think we have to empower patients. I think we have to create tools. Where we're headed is, patients literally having a personal dashboard of their own, where they can see how their behavior impacts their lifespan and their health span. Two different things, right? You don't just want a long lifespan. You want a long health span, because you could be miserable in your old age if you don't take care of your body, right? So all these things we can now start to demonstrate with real data. Before it was just a story. Now with AI, we can start to really demonstrate that. And so yeah, no, it's a great time to be alive. I think a lot of the things that a lot of these things have been talked about for a while, but we couldn't prove it. Now we can start to prove this stuff.
Yeah. And I think it is, this interesting moment in time, as you mentioned, is looking back at the last decades or, 50, 100 years, it was such a wave of this globalization, centralization of power. And then as that enormous centralization of power occurs, you've got, some good actors and some not so good actors, or acting that is maybe short-sighted or self-serving. And then you see the effect of that when there's so much central power. And now you see through blockchain or through just as kind of general decentralization theme, where people are more in power of their finances, on their phone with banking or stock trading, and as you say, now the next wave is you've supported the practitioners. Now it's like, well, let's put health into people's hands, truly put into people's hands. Right. I think that is so exciting how it all comes together. Will be interesting, but it's so critical. And to align rewards, this is where I kind of get to my mind, like when you've got, in some ways unfortunate, but fortunately, when you've got economic alignment or reward systems, in the world that we live in is, so often it's cash, it's US dollar or Canadian dollar, that reigns supreme. And that's your reward system for behavior that drives behavior. Yeah. At least in the West, right? At least in the West. But can there be progress in healthcare, and can you reward good behavior? Is there a way to reward good behavior where it rewards the patient? They see real tangible results. They put less stress on the healthcare system inevitably. Yeah.
Well,
it's a nice dream.
Yeah, totally. Well, this was a vision of yours that got me thinking, because in our previous conversations, because you've been so successful in a variety of areas, but also I know you have a keen interest in blockchain, and blockchain has this very interesting ability to align incentives, right, and create reward systems and that are not centralized in nature, right? Like if I take good actions and my data is able to help a greater data set, can I get rewarded for that? It
makes logical sense.
Yeah, I think it's going to happen. I'm already seeing business models. I just met a company yesterday that is helping people with a personal vault, and aggregate their data and introducing the idea of points, where you can then, contribute your data and you get points from certain companies. Starting to already see it. They approached us because they want the ability to receive healthcare information as part of that vault system. Yeah,
bring in that plumbing for
exactly. But look, what you said was interesting about just the industry as a whole and what we're seeing. It's interesting. We've been talking a lot with a lot of, people in healthcare about, data science and moving data around and empowering people. And it's almost funny. There's a term that people in the healthcare industry use when they're talking about EMR data. So EMR stands for electronic medical records. This is the practice management system that the clinics use. So instead of the wall of folders, there's a digital folders where all this information is digitized. And the industry is very excited about this last couple decades, using this stuff. But all that's really happened is they've moved from the data being, in on a bunch of paper, digitally, and they haven't really done anything with it other than just retrieve it and read it, right? And they actually talk about this term called data liberation, almost like it's like the data's a prisoner, because we're not empowering patients with it. The doctor will write a bunch of stuff, and it's just done. It's there, and it's there for the doctor to see. We need patients to be empowered with this, right?
Of course, and society. Yeah. I guess maybe society at large to be empowered with scraping of that data. Here's what we learned. Here's what this machine learned. It's
right. And then you combine that with the data that, these Apple Watches and other gadgets are starting to generate. We're generating huge amounts of user-generated data. And if you start to integrate that with, the data that care providers are generating, and you start comparing that with neural networks and what's going on out there, I think it's somewhat sobering as a person when you see, okay, well, these are my metrics. So what? That's my life. But when you say, well, average person of your age, these are their metrics.
Yes.
How do you compare against that? It gives us perspective.
Yeah, it
right?
gives a bit of a gamification opportunity. So
wait a sec. I'm not doing as well. So gamification is what helps engagement. It's what is what. Whoa, you mean I'm not doing well as well as the average person? I want to be above average.
Yes.
So that I think is very good. I think that that's coming, I think, at scale. We're starting to already see that with the Apple Health app.
Yes.
It's starting to tell you if your resting heart rate or your, heart rate variability or even your VO2 max, all these kinds of things, which is a measure of your cardiovascular health, how that's actually comparing versus others or what have you. And it's good. I was looking at it the other day and I was like, I gotta do more cardiovascular work, So,
well, that's rewarding good behavior.
Yeah.
I think I'll just finish with, because we've covered a lot of ground. Where do you think this is and I guess maybe we touched on it a little bit earlier, but why is this now and not 2-3 years from now? Why is this such a critical now situation, whether it's for society, for investors, for
That's an excellent question. I think it is in many ways one of the most important questions, because when blockchain came out, this is a very powerful technology, but in a way it was a bit of a solution looking for a problem, right? Like, and people were like, this is incredible technology. Where can we use it?
Right. Yeah. And it's interesting. And it's taken some twists and turns and manifestations that actually are distracting from the fundamental, quality and breakthrough of the underlying tech.
Totally.
It's gone distracted through speculation and, go ahead.
Yeah. And so here, the problem is looking you right in the face. It's like, and again, if you've just been generally reading the paper over the last couple of years, you will there's so many articles and commentaries and opinion posts and about the state of the healthcare ecosystem. And I don't care if you're in the US or Canada, both of them could be deemed as being broken in some ways. Now, look, there's incredible people at the public health level, doing amazing things to drive these things forward. And I think, in many respects, our Canadian system is more advantageous and more desirable because we don't leave as many people behind. We try to take care of everyone here, but there is enormous fatigue and concern and challenges with the system because of that backbone, that provider. That provider is getting so frustrated that they're starting to leave the profession. And particularly in primary care, that $30-$35 example is in primary care, not dermatologists, not cardiologists, not, the specialists, right? And so we really want a strong primary care ecosystem because, that is the person that truly is there for your healthcare.
Yeah.
Because they're the ones practicing more of the preventative care. When you have to go to specialists, something's already happened and evolved to the point where I need you to go on the next stop in your health journey to see one of these specialists, right? And so, we're really hoping and driving and creating solutions that stabilize and try to bring back, some of these guys. One of the things that's happened in Canada is we've been encouraging primary care practitioners to start their own practices. So we have an extremely fragmented system with very few networks. What we're seeing with the new field of doctors come in, the millennial and Gen Zs, is that they actually don't want to run their own practice. And part of this is about technology because now it's not like it used to be. It's not a steel stethoscope, paper records, and I just got my wall of folders and I get going, Now it's becoming more and more sophisticated, and the needs for healthcare are expanding. So they want to practice in a well-managed, ecosystem where technology is available for them. So I think what we're starting to see is the trends of the country in terms of, bigger networks where physicians can work together and they can really focus on care and not have to worry about running a business where all this technology's looked after for them. So that all, again, I'm an optimist and I think, the problems that we're seeing, we have the solutions now. And I think AI is going to really help us. And I think we just gotta, just stay focused on tangible delivery benefits, not get focused on the whiz bang, cool stuff, but just, how do we help doctors? And this is with the AI scribes and the clinical decision supports. I think in 2, 3, 4 years, you're going to be hard pressed to find a doctor that's not impacted by AI, which is pretty amazing. 2 years ago, I would have told you it would have been over a decade, but not anymore. So exciting times.
Well, we're lucky to have you. Canada's lucky to have
Thank
you
you.
as an incredible entrepreneur. Capital markets are lucky to have you. So
Thank you.
all the best. And I'm here to support every way I can.
We're so thrilled to partner with you and excited to really launch on this journey. It's been a great start and we have incredible catalysts lined up, growth lined up, just the outpouring of interest. Not just from the healthcare industry, but the capital markets at large. I think people want to see an AI winner you mentioned this a bit earlier, to cultivate an AI industry here in Canada. We have so many great brains and minds here.
Yeah.
And the scene is set. I mean, Oracle, one of the largest data science companies and software companies in the world, went out and bought the second largest hospital software company, Cerner, in the world for $28 billion deal, the biggest deal ever in healthcare IT history. And people were like stunned. They're like, why did they do that? It's like, because of the data richness and the potential in organizing and repurposing and helping drive the data of healthcare. And it's actually done well for their business and their stock. And I think, there's hundreds and thousands of medical systems and healthcare information custodians all over the world. They need AI. They need safe AI with the right guardrails, and I think we're going to be a great contender to support them. So
I agree.
Here we go.
Thanks for your time.
Thank you. Such a pleasure.